Hi everyone, this is Dr. Mansi. We are back again on the series of Beyond Boundaries with Homeopathy 360. And today we have Dr. Kanika Sabharwal ma'am on the topic Periodic Table Group 2nd A Remedies in Pediatric Practice. Now let's know Dr. Kanika ma'am. Dr. Kanika Sabharwal ma'am is an alumni of CMP Homeopathic Medical College and is an assistant professor in the Department of Obstetrics and Gynae at her alma mater since 9.5 years. She was a gold medalist at the MD entrance exam, after which she pursued her MD in pediatrics. Women and child healthcare is the focus of her practice and research. She has presented at international conferences such as Homeopathic Research Institute, London, Ayush International Conference, Dubai, and International Development Pediatric Association Congress, Mumbai. She has also peer-reviewed articles and published in the various journals and has many 6 e-books being published. We are very inspired from you, ma'am. And ma'am, would you like to share the reason behind choosing this topic?
So I actually, Materia Medica has been one of my favorite subjects since I was a student of homeopathy. And I enjoy group study for 2 reasons. One, I think student, it just made it a little easier to kind of understand and remember Materia Medica. And in practice, it's helped me a lot. So, when you talk about especially the periodic table, there's something called synthetic prescriptions. So in my practice, I've actually used that method of prescribing quite frequently with good results. So I thought that I would share some of my experiences and insights with your audience today.
Thank you so much, ma'am, for sparing some time for this webinar, and we are very eager to.
All right, so I'm gonna begin with this. Just thank you so much for being so punctual, all of you. Uh, Today, like I said, we're going to talk a little bit about the periodic table, and I want to share my experiences in applying the group knowledge of periodic table specifically to a pediatric practice. How many of y'all are practitioners? Can I just get a sense of, what the audience is? Are there students? Are there practitioners? Okay. So we have a mixed bag, a lot of students. All right. So since we have a lot of students here and people who are new to practice, we will cover the basics a little bit and then we'll go ahead. Yeah. All right. So from a homeopathic perspective, how you can approach it. I'm going to focus on the theme of the group 2 elements, talk about some remedies that I use in practice, and demonstrate it through cases. I hope we're able to cover everything. If not, we can just focus on the parts that are important for you. All right. So I've already spoken about this. The reason I selected this topic is because, and most of you who are students, you relate to this. It just seems like Materia Medica doesn't end, right? There are 3,000 remedies. So what I found when I was a student, and I still am a student, is that this group analysis, whether it's plant, mineral, or animal kingdom, it helps you to kind of narrow down your selection of the remedy. I'm not going to go into the details, but if I were to summarize the kingdom of the analysis, the kingdom understanding in just one line, when you talk about the plant kingdom, the core themes are related to sensitivity and adaptation. So because there is high sensitivity, there is difficulty in adapting to situations, which is why patients in your clinic and in your practice who may eventually require a plant remedy will be those patients who will talk a lot about themselves. So During case taking, they will use a lot of phrases like, I felt this, that was done to hurt me. There's a lot of expression of their sensations, their feelings, and a lot of their talk and their sentences will be focused around I and me. If you talk about the animal kingdom, the core theme, like we know in nature, is competition and competitiveness. Why? Because it is a survival instinct. I have to compete with other animals for my existence. I have to compete for my food, right? That's how we have the concept of a predator and a prey. And the third group, or the kingdom, that is the mineral kingdom, which is our focus of today, is concerned with structure and organization. So we'll talk about this in a minute. For mineral kingdom, that is the periodic table, I'm going to give you just a 3-4 point understanding to make this approach quite easy. Point number 1 that I want everyone to remember is that we understand the periodic table based on its atomic number of the element, not the weight. All right. So please remember that. Can you all see column 2A? Yeah, that's the one that we're going to focus on today. It contains elements like beryllium, magnesium, calcarea, that is calcium, baryta, and radium. Now, throughout the session, I'm going to focus on magnesium, calcarea, and barium because those are the salts that have the remedies that have more proving, and to be honest, the ones that I have used more in my practice. So I hope everybody can see the periodic table and familiarize them with this group. That's what we're going to cover today. All right. So how do you understand the structure of this periodic table, right? You're familiar with it. You've studied it in 12th standard chemistry. But what does it mean from a homeopathic perspective? It is arranged into 18 vertical columns and 7 horizontal rows or periods. Each element is arranged as per its atomic number. The ones on the left side, that is group 1 and 2, are electropositive. As you go towards the right, they are electronegative. And the last column, that is your noble gases, they are inert. Now I'm going to go a little bit into chemistry. What does this mean? Electropositive, they have the electrons in the outermost orbit that they can readily give away. And the inert ones, where their orbit is complete. So that is why they are called noble gases, because their orbit is complete. They don't interact with any. Now, taking you through a little bit about the theme, broadly, if I were to talk about the periodic table, each row, that is the horizontal row, from row 1 to row 7, talks about or goes through the journey of life. So, for example, row 1, that has just 2 elements, talks about fetal life and intrauterine life. Therefore, the themes or the issues of these elements are related to conception and actual existence. If you go to the next row, that is row 2, which has remedies like lithium, we are talking about the process of labor or birth. And these remedies in their symptoms have symptoms such as fear of downward motion, which metaphorically is understood as the process of coming down the birth canal. Similarly, row 3 talks about identity, because once you are in the world, you are a separate unit from your mother, and now you need to develop your own identity. So on and so forth. This is how each row has been equated with or described with the journey through life. Since that is not our topic of today, I'm going to proceed and not go into the details. Similarly, each of the 18 columns represents a cycle of life. So what do I mean with that cycle? The elements at the top of the vertical column are concerned with the beginning of a project. The middle section is accomplishment or achieving that project or accomplishing your task. And the end or the bottom elements of each column talk about the decline. So if those of you who are interested in knowing more about this theme and the actual structure of the periodic table, we have stalwarts like Dr. Shankar and Dr. Sholton who have done the main work in periodic table. So I urge you to refer to their literature. Coming back to mineral kingdom, if I had to teach you and summarize it for you in one line, this is my line, which is why I put it in bold red. Mineral kingdom remedies, or people that require this, the mineral remedies, have a core theme which says I will survive if I build my own resources and make my structure strong. So these are the people that say, my future is secured if today I put in the hard work and make my foundation strong. Let me give you an example in case some of you in the audience have heard some of my previous seminars, or if you're familiar with my style of teaching, you'll know this. I always give an example when I teach periodic table of the a movie called Three Idiots. So if all of you have seen a movie called Three Idiots, there is a main character in that film that's played by Amir Khan. Amir Khan in the movie, we come to know later on, he, initially they show him part of this engineering college, and he's a very enthusiastic student who isn't much concerned with marks. And later on, we get to know that he doesn't actually get the degree. He pursues engineering, but the degree goes to someone else. But at the end of that film, they show how successful he is, right? He runs a school on one side, which is his kind of way to give back to society and train the next generation. But you also get to know in the last scene, where he's kind of giving an autograph or signing a deal for the other character, that he has over 100 patents to his name and he's one of the most successful businessmen of the time. Do you remember this? Do you all watch Bollywood or you only study homeopathy? Yes, tell me in the chat box if you've seen this movie called Three Idiots. I like my sessions to be interactive, so I'm going to request you all to, be a little bit more engaging. Yes, you remember this scene, right? So what was Amir Khan doing? What does his character do? His character is building resources. He is building on knowledge. He's not concerned with the degree. He comes first. That's a separate story. So that is called Chatur. Now, if you see what Chatur does before the exams, while everyone is studying, he distributes magazines to all the hostel dorm rooms to distract. Do you remember this scene of distraction? So, what is he doing? What is he doing? Is he building his resources? No. He's distracting the competition that you don't study, so I get ahead. Competitive instinct, animal kingdom, right? So this is in a very small, simple way, if I can explain to you an introduction to the two kingdoms. If you want me to give you an example of plant kingdom using the same remedy, there is a third character in the film whose name is Raju. Sharman Joshi is the actor. So if you see before exams, what does this character do? You see him wearing multiple rings, you see him praying to God, right? Do you remember this scene where he's wearing multiple rings and he's praying to God and he's kind of negotiating a deal? It almost seems as if he's begging. Right? I tell my students, you've all done this. Whichever God you believe in. God, please just let me pass anat physio. I promise I'll study patho from day one. So this is plant kingdom, and there's a remedy called stramonium where it's written beseeching, almost like pleading, right? So sensitivity, he's so nervous about failing, he's very anxious. So this is in a gist the introduction to the three kingdoms. Is it clear with everyone? May I proceed? All right. So let's go ahead. Like I've said before, this kingdom is concerned with structure, organization. They are high performers, which stems from anxiety. So you have remedies like Argentum, so much concerned with their performance. You have Aurum, right? Very strong personalities, very systematic. So much so that the patients will even come with a file. Arsenic patients come with a file in chronological order with post-its. Doctor, on 19th March 2022, I had COVID. This is the medicine which I took. So very structured, very systematic, even when telling you their complaints. They may speak in detail, but they speak precisely and to the point. Appearance-wise, very neat and tidy, very well put together, well dressed. They may go for symmetrical patterns such as checks or stripes. At the pathological level, they may present to you with more chronic complaints that are slowly progressing. And when on the one side there is anxiety about performance, the ailments from is when there is a lack in that performance. So job, failure in an exam, business failure, these are some of the ailments from. All right. This is the way I have studied the periodic table, and I would like to share it with you. Those of you who are practitioners, I saw some of you mention that in the chat box. Tell me if you relate to this or any examples you can think of. When you look at the periodic table, okay, divide it in your mind into the left, the middle, and the right side. Here we can study or correlate it clinically with all our subjects of medicine, starting with embryology. If you see the left side of the table, which concerns your natrum group, Kali, Calcarea, Baryta, the sphere of action is the skin and mucous membrane. And embryologically, these develop from the ectoderm. Middle sphere of action is musculoskeletal system. Your argentum comes here, metals come here, cobalt, nickel, ferrum. Here, these are the sphere of action is on those structures which develop from the mesoderm. And the right side, where we have our halogens like iodium, where we have remedies like aurum, where we have remedies like arsenic, they are the deep acting remedies which act on the central nervous system, CVS, endocrine, which develops from the endoderm. So if you correlated this now with pathology, what do you find? That the remedies on the left side of the periodic table cause changes which have altered sensation, functional changes which are reversible. Now, let me give you a quick example. There's a remedy over here called causticum. Now, causticum is a salt of potassium. Causticum is a good remedy for functional paralysis, which is reversible. Whereas on the right side of the periodic table, where you have remedies like zinc, we will talk about paralysis, which is structural and irreversible. So this is another way to study the periodic table. And then there's no materia ever without organon. So if you translate that into the language of organon, you find that these remedies are more storic. The ones in the middle of the periodic table are more psychotic, where there are structural changes, but you can reverse it, right? If you're treating a ligament tear, grade 1, grade 2, it is a structural change. But yes, it can be reversed. So that is the psychotic pathology. And the ones on the right, remedies like, again, I gave the example of iodium, which causes so much destruction. Fluoride, fluoric acid for osteomyelitis. Structural change, irreversible. So this is the way that one can correlate your knowledge of medicine with homeopathic subjects. All right, so that is a broad introduction to kingdoms, to the periodic table. Now let's jump to our focus of the day, Group 2. I am going to again first talk about physiology and then give you the doctrine of signature in homeopathy. Two important elements in this group, one is calcium and one is magnesium. All of you are familiar with the role of calcium in your body. I need not tell you. It forms an important structure of our bones and teeth. It is a component in blood and has a role to play in the clotting mechanism, and helps in muscle contraction. Similarly, magnesium present on almost all components of our body. It's a good source of energy. It helps in the processes of DNA synthesis, synthesizing certain important enzymes, and has a role to play in maintaining electrolyte balance. So this is at a physiological level. What that translates into our remedies, we shall see. Sphere of action, as we know, marked action on the bones and ligaments. You all know about Calcarea Phos, Calcarea Flor. Sphere of action on blood and its components and connective tissue. But what does it do? What is the pathogenesis? There is a marked pathogenesis or mechanism of action on both spasms as well as relaxation of smooth muscles and the mucosa of the gut, that is the GI tract. So what does that do? It causes patchy circulation, it causes defect in nutrition and in metabolism, right? We are all familiar with Calcarea Carb. The words used are malnutrition and malassimilation, which means the body is unable to assimilate the nutrients. Involvement of glands and overall slowness of functioning. Now, slowness of functioning, everybody knows when you talk about Calcarea and Baryta. So what is the theme of this group? The main theme is I require support. Now go back 2 slides and focus on the physiological action. Don't you think calcium, being such an important component of bony structures, is providing support? And magnesium, which is important to give energy and DNA synthesis, is supporting life in itself. So the main theme of this group is support. And you see it in a very different way in both these elements, because in magnesium, as I said, it is supporting life itself, the inception of life. That's why magnesium, when we talk about it later, we'll talk about how it has problems when it doesn't receive that nourishment or that support, right? In a more sort of at a more psychological level. Calcium or Calcarea remedies, when we go ahead, we'll see support is also in more materialistic or structural things like bones. What happens? How do these remedies, what is the problem, or when does a person require these remedies? When this structure or when this support system is under stress and my support system weakens or fails entirely, my structure collapses or relaxes and it invites trouble. This is the core theme of the group 2 elements. Now I'm going to talk you through some important mental characteristics that we have seen that run through these remedies. I'm going to give you a few examples. Now, just a small disclaimer, there may be exceptions. It is not a blanket rule that these themes will be found in every remedy belonging to group 2, but majority, yes. And I will show you some snippets from the repertory to confirm, right? So we can study our materia and repertory in parallel. At any point, if you have questions, please stop me, raise your hand. I'm happy to take questions in the moment so that it doesn't break the chain for you. All right. So the first group theme that I'm going to talk to you about is the theme of being observed. Both Calcarea and Baryta have a sensitivity where they feel that people are looking at me. People are talking about me. And when we feel people are talking about us, what do we feel that people are talking? Do we usually think that, oh, people are praising us? We feel that people criticize us. It's human nature. Someone is an angry personality and they're at a party. They see two at a distance talking, looking in their direction. Automatically the mind goes and says, oh, मेरे बारे में बात कर रहे होंगे. क्या बोल रहे होंगे? Am I looking okay? Am I fine? So this is very strong group. For instance, there is a symptom beryllium, where it says he looks at himself as if he is not himself. So unsure he is. Magnesium feels that I am not worthy of a relationship and therefore my family forsakes me. Calcarea feels incompetent. I cannot manage any task and everybody is watching. So they have given the example in materia that neighbors are observing. But what we understand is that people are watching. Now, if you're so concerned and you're so conscious about people watching you, what is the next symptom that it invites? It invites a sensitivity to be criticized. Right? So, if I feel someone is observing me or judging me, I am A, sensitive to their opinion, and B, I feel as if I am being criticized. So, they constantly feel that they are being judged and humiliated. This is very strong in both Calcarea and Baryta. There's a slight difference where Baryta is one step further than Calcarea. Calcarea feels people are judging me, what will people think of me? But Baryta is sure that people consider me a fool. People think that I'm an idiot, I'm not capable. So there's a slight difference, but this is common to both these elements. So let me draw your attention to the rubric, sensitive to criticism. Here, can you see Baryta carb, beryllium, group 2? Look at the amount of calcarea salts in this rubric. Carb, brom, fluoride, lac, mure, nitricum, phos, sulfur, silicata. Almost all your calcarea salts are present in this particular rubric. Magnesium group is not so marked. We all know this one. This is an easy one. Everyone is familiar with it. The most timid, the most bashful remedies belong to group 2. Now, why is that? That is because they are not sure of their capabilities. Okay, I would like to read this line out. They feel so unsure of themselves that they don't say or do anything. They are passive because they are convinced that there's no point. मतलब मुझे आंसर आता ही नहीं, मैं जो बोलूंगी गलत ही बोलूंगी, so why should I answer? And because of this, many times their talent remains hidden. I'll give you an example. When all of you joined medical school, right? First week of any class, first year, second year, teachers come in, they say, okay, who wants to be the CR? Who wants to be the GS of the college? All of that. There's some people who instantly have the confidence who say, no, I'm going to do it. And there are some who will just not make eye contact with the teacher. They won't raise their hand. The teacher will ask them, would you like to participate? Can you answer something? Even though they know the answer, they're so conscious that my answer will be wrong that they don't volunteer to even make an attempt. Right? Let us again come back to our example. Baryta carb, Baryta phos, Calcarea carb, Calcarea brom, mute, sulf silicata. Right? So as you see, again, not much magnesium in this rubric, but a lot of calcarea and baryta. Now, because they are so unsure, because of don't have a inner frame of reference that what is right, what is wrong, do I know what I'm doing? They are very inclined to adapt. So because you're not sure whether you know what's right or wrong, you just assume that the group knows better than you and anyone knows better than you. So they adapt themselves to fit in with the group or the other people's opinion, and they become very passive. So this is very important again in group 2. Pacifism is strongest in magnesium. We'll come to that later. So if I'm so conscious that what will others think of me, if I am so insecure, if I feel I'm not capable, what will I do? I will protect myself to cover up my flaws. So how do I protect myself? I won't answer. If I don't answer, the teacher can't tell me I'm wrong. She can't shout at me in front of the whole class. If I'm a child in the doctor's clinic, I'll hide behind a chair. Right? How often have we seen this in clinic? You see it in your materia medica also, it is written. Child hides behind the chair. Child hides behind the mother. Or the doctor asks the child a question, the child looks there, Mama, you say. Right? So this is a way wherein they are protecting themselves. Okay, so can we see again some repertory references? Hiding himself, Baryta carb, Calcarea carb. Cannot bear to be looked at, does not want to make eye contact. Baryta carb, Baryta iodide, Calcarea carb, right? So this is an expression or an extension of the insecurity where they want to protect themselves. Support, I have already told you. Now I want to tell you what happens next. When someone requires a lot of support, it may gradually turn towards rigidity. So when I'm so concerned about my structure, I can make my structure very hard and rigid. So nobody can penetrate that. And if my structure is rigid on top of me, it causes stagnation in my own development because even I can't cross that boundary. Are you all able to hear me? Somebody just says that my voice is breaking. Are you all with me so far? Can you see the slide of support? Just a quick feedback so that we can go ahead. We have a long way to go. Your voice is breaking. Okay, just a minute. Your voice is clear. Okay, so some people are saying it's clear and the slide is visible. So just couple of people who feel that my voice is not clear, can you check your connection? Oh, okay. Okay, 1 minute. Sorry, let me also check. I wish you had told me earlier. Just a moment. Okay, one sec. Sorry about this. Give me 1 minute. All right. I've just restarted it. Let me know now if it's any better at your end. We were talking about support, right? That's the slide that you could all see. That's the last one. This is where we kind of took a break, and I was talking about the structure becoming rigid. So this is by and large the group themes that I wanted to convey to you. Now the problem is that this structure that they are able to build is very temporary. So when we understand it, we equate it to a tent. Now all of you have gone camping or know what a tent is, I hope. Tent is a temporary structure that one builds. It's a temporary home that one builds when one goes camping or stays in the woods. Now, this tent-like structure, which is built by these remedies and elements of Group 2A, is very temporary because it cannot withstand environmental stresses. So this is what happens in Group 2. The foundation is weak. So when there's any stress, okay, I'll continue my tent example, then I'll come to remedies. If you have a tent and you're camping and there's suddenly a gush of wind or heavy downpour, like we had a few days ago in the city of Bombay, what is going to happen to that tent? You're going to get soaked, water is going to seep through the tent, will collapse. So this is what happens to Group 2. We are just at the start of the periodic table. We are just building the structure. The foundation is not very strong, and therefore, if there is a slightest stress, the foundation and the structure breaks down. That invites trouble. So this is a summary and just an overview of the elements of Group 2. Have you all understood? Is this space okay? Can I go to individual elements? Any questions at this point? Just give me feedback. Have you all understood so far? Are you able to correlate the periodic table now? Yes, anyone would like to ask any questions or any responses? Why there is slowness in calcium? Yeah, Dr. Forum, it's on both ways. One is the mental slowness because of developmental delay and slow development. We'll talk about that when we do individual groups. And at the physical level, why is there slowness? Because of, like I said, malassimilation. Take examples of two remedies, Calcarea Carb, which is for overnutrition and obesity, but malassimilation. So the nutrients are not absorbed clearly. Calcarea Phos, malnutrition on the other side, emaciation, mag carb, again malassimilation. So your nutrients is not absorbed. And that slowness is related to the slowness in digestion. Dr. Chinmay says, hiding behind a chair can be found in many children. So when to take it as PQRS? So Dr. Chinmay, what I would suggest is that like in homeopathy, we never rely on a single symptom. And to grade something as PQRS, we can see the theme. If you feel that there is timidity and bashfulness which is running across the child or the patient, there have been multiple examples where you're able to see, even in answering, even in, let's say it's a follow-up or the patient is familiar with you, and still there is so much shyness where they're evading eye contact, where they are hiding behind the chair. So the intensity is marked and you have confirmed it at multiple instances, then you may consider it as a characteristic. Dr. Abhishek, the periodic table, you can I can share it at the end of the session. Otherwise, you can get it online. It's the one by Medvedev is the one that we refer to. Yes, Dr. Forum, we are now moving to that. I think we are quite short on time also. So, yeah, so this is a very good question by Dr. Mohammed, and I want to talk about that. So, we'll take a minute. When we talk about elements, right? Now, all of you are familiar, natrum, mure, calcarea, phos. So, who dominates the elements? Is it the calcareas and the natrums, which are the positive ions on the left side of the periodic table, or is it the negative, the sulf, the phos element? So, which do you think overpowers? Positive, does positive overpower or negative? Who influences you more? Your friends who are good influences who say, don't bunk lectures, let's study everything. Yes, I was asking you, in your experience, who influences you more? Your friends who tell you to attend lectures, and those who say, oh, let's study from day one, day two, or your friends who say, let's bunk one, two lectures and go out instead? Do you think positive has a greater influence or negative? When we talk about the periodic table, it is the negative ions, such as the sulfurs, the muriaticums, the silicatas, that have more of an influence. All right. So let me give you an example of what happens in my college and in our OPD. My students often, after case taking, we ask them, what is the diagnosis you suspect? What remedy are you thinking of? So even my students, they'll very confidently say, ma'am, I'm thinking of calcarea. Ma'am, patient looks like natrum. But which one, which salt is what helps us to decide? So it's very important to remember. Yes, exactly. The negative ones are the ones that dominate. So very often, does this happen with you, those of you who are practicing, where you've taken a case and you feel, okay, patient looks like calcarea, patient looks like potassium, kali, but I'm not sure. Or maximum you say hot patient, so kali sulfur, kali iode, but I'm still not sure. So it is those ions that help to determine. All right, I think let's go ahead because it's already 5:45 and we've not started individual groups. We'll go a bit faster. All right, and then we can go back to questions later. So in a nutshell, the three groups that we're going to discuss now in the next few minutes. The situation of magnesium is like that of a newborn or a nursling who is still not metaphorically cut off from the umbilical cord of the mother. A lot of attachment to parents, family. Calcarea, the fixation comes at slightly older age group where they don't have to depend on parents for each thing. They are independent in a sense, but the need for security and protection continues. And in Baraita, the problem lies with performance. So, learning their tasks, what is their responsibility, what is their job, and becoming useful in life. Now, these are just words that you don't have to take at face value. There's a lot of deeper meaning, which we will talk about. All right. So, let us start with the individual groups. I may skip the remedies because that I think you can get from materia. I'll talk about group indications and tell me if you want me to do case examples. So now I'm talking purely from a pediatric point of view. So far also I have been focusing more on the pediatric indications. Calcarea is equated to like a young child who realizes that the outside world is very unstable. There are a lot of forces that can affect me, and I am safest and most protected in my home environment. Often in Calcarea, you will find that the home environment is one that is very pampering, very much overprotective, and that provides a double layer of security, right? Most people feel very safe in their houses. And we'll contrast this with magnesium when we talk about it in the next few minutes. But in Calcarea, there is that added layer because the family setup and the parents are that overprotective. What happens in this case is the child feels insecure to take any risk or to step out of their comfort zone at all. And as these children get older, you will see these are the people who stick to the same friend circle, the same job they will hold for years together because they don't want to venture into anything new. If they've started a job, they've learned the job, they know how to execute it, that becomes a comfort zone. So they don't want to take any risk. Often they will be the people that are unable to even decide. It's very common when one is a child where everyone asks you, what do you want to become when you grow up? Or what would you like to do after school, college? But these are the people who are unable to take their own decisions. All right, talking about magnesium. Now, all of you have heard and read about where Kent talks about magnesium as the remedy for orphans. Right? I hope everyone is familiar with the instance where Dr. Kent was treating again. The diagnosis of those children was a condition of malabsorption, failure to thrive. They were not gaining weight, their nutrition was poor. And when he took the case, the two remedies that he found to be very useful in those cases were magnesium carb and magnesium mute. So therefore, they turned out to be termed as orphan remedies. But what does that mean? You don't only give it to somebody who is unfortunately an orphan. This insecurity in magnesium arises due to an unpleasant childhood that may stem from squabble between the parents, either a lot of arguments or a parental separation, divorce, which we do see is on the rise now, parents splitting up when the child is very young, or it could be that the child just perceives that he or she is getting less attention, right? Let's say both parents are working. The maternity and paternity leave is over, the parents have to get back to work. But when they finish work and they come home, they are giving adequate time and love to the child. But for this child, that is not enough. So you have to assess, not everything is at theory value where it's just you pick up the words. Please understand, since there are a lot of students in the audience, I am specifying this that you have to rely on your understanding of the situation as well. Now, what does this lead to? It causes a development of an unprotected child who feels that I have been rejected. My parents left me with a caretaker, with a nanny in a daycare. They rejected me and they went to work. Or really that has happened where one parent has, there's a separation and only one parent is got custody. So this magnesium, these people develop a feeling of being unprotected and uncared for in the childhood when they needed it the most. Talking about Baraita, again, lot of insecurity related to self, to understand their own capabilities. Barium or Baraita salts, patients feel that they are unable to stand on their own 2 feet, right? Now, this is a very common expression in English, right? Everybody says that when you grow up, you should be able to stand on your own feet. What does that mean? That means being capable of independent existence, whether it's fending for yourself financially, whether it's, managing your house, your needs. So in Baraita, this is seen as a sense of being unable to stand on their own feet and requiring external support. This can be seen in a delusion. Those of you who have repertory handy or if you use it on your phone, I request you to just see the rubric. Delusion walking on knees. Can you just find that rubric, anyone, for me? Delusion walking on knees. In the meanwhile, I'll just answer this question. Somebody has asked when to take a thematic approach and when to go for a repertorial approach. All right, so to be honest, if you're somebody who prescribes using the repertory, which most of us should do, to be honest, you should repertorize your cases. When to use the thematic approach? When, as a practitioner, when you've taken a good case, you have strong symptoms or themes that cover 2 elements. So I'll show you case examples also for this reason, where you say, okay, there are these elements that cover Calcarea, but not Calcarea Carb Classic. There are 4 to 5 strong generals which are pointing towards Silesia. So then, and you see in your repertorial totality that both Calcarea Carb and Silesia are coming within the first 10 remedies. Then you can think of choosing a thematic approach or a synthetic approach like Calcarea Silicata. Because these remedies are not proved so much, right? So Natrum Sil, natrum Rs, they are not so well proved, so they won't show up directly in your repertory. That is why we use a synthetic approach. Did anyone get the rubric? Delusion walking on knees? Okay, thank you, Dr. Seema. So can we see Baraita, Carb, Baraita, Mibra, and Meadow? Three remedies which are very, very good for developmental delays. Since we are talking pediatrics today, those who have developmental delays, delayed milestones, both physical and cognitive. And what does this mean? This means that I'm incapable of standing on my own 2 feet. Okay, so this is the metaphorical approach. Thank you, Dr. Seema and Dr. Komal. All right, let's go ahead. So I'll quickly run through the Calcarea group. Doctrine of signature, especially Calcarea carb, calcium is a part of the bony skeleton. What does the bony skeleton in your body do? It protects delicate organs. For example, skull protects your brain, thorax, rib cage protects your heart and lungs, pelvic girdle protects reproductive organs, vertebral column protects spinal cord and nerves. So if you see all the delicate organs that are required for survival, all your vital organs, they are covered and protected by this external bony skeleton. And that is what you see in Calcarea. Especially Calcarea carb, everybody knows, outer shell, inner delicate oyster. So this is the doctrine of signature. By and large, the constitution leans more towards flabby children who have slow movement, slow and irregular growth, and tendency to hard and enlarged glands. Right? You could read Calcarea Carb Introduction from Bolek, you could talk about Calcarea iode, and you will see this particular theme. Dr. Forum, here's the answer to your question. Everything is sluggish, both delays both at mental and physical level. So much so that since I'm a teacher of gynac, I'll give the example of gynac. Even if you see delayed puberty, you will see Calcarea remedies. So slowness. Tendency to obesity and Calcarea phos, as I've already explained, is the exception where the Calcarea phos patient is more emaciated but still with a scrofulous diathesis prone to glands. General traits, very, very concerned about others' opinion, and others should not know that I am indecisive and that I'm confused. For this reason, they usually crave appreciation. And no one craves appreciation more than Calcarea sulf. You can see stalwart authors talk about this remedy. Look at the bottom. Dr. Kent, Dr. Farooq Master, and Dr. Fatak. So stalwarts in homeopathy confirming this for you. Mind delusion. She feels others will observe and notice her confusion. Calcarea carb. Alright. Going back, those of you who don't know, limestone is a rare remedy which is also a calcarea salt. Okay, just to draw your attention. Sensitive to opinion of others. Now just look at how many calcarea salts are in this rubric. Just look, almost all. That tells you how strong this theme is. As we discussed in our introduction, when one is concerned about others' opinion, they become all the more sensitive to criticism. Now, again, here you can see we've shown you this before. Baryta, beryllium, calcarea, all of them. As I was talking to you in the past about feeling safe, right? Calcarea carb feels very safe in their own house because they are one of the most fearful remedies. If you read Calcarea group from Dr. Shankaran's book, you will see that he talks about calcarea as having fear of everything. Fear of nature, fear of animals, fear of humans. Okay, one of the most fearful remedies that we have. Depending on each remedy, you can see the examples: fear of seeing blood, fear of doctor, fear of dentist, various examples. How often have all of you noticed this, right? Even in your clinic or in your practice, even in adults, we say Calcarea carb always needs support. Calcarea patients are the ones who bring a neighbor or bring somebody. They don't like to come for consultation also alone. So always accompanied by someone. In contrast, you have some even 7 and 8-year-olds who sit in your clinic and who are so precautious they give you the whole history themselves. You need not even ask the parent who accompanies them. So this is how we get a remedy differentiation. Protection and withdrawal. How do they protect themselves? By withdrawing. So again, Calcarea carb shell, doctrine of signature carbs. What do? They go into a shell. They withdraw from the situation. They take a step back. So this tendency to hold on and to be passive or to become hard can be seen in local complaints. For example, Calcarea floor, Calcarea iodide, so much induration. Induration means hardening, right? So they take a step back, they go into their shell and they harden their protective mechanisms. This is what happens when they feel threatened or under stress. They like company because it's a form of support. And as I told you in the past, they like their comfort zone. So aversion to change. Can you see Baryta carb and Calcarea floor in aversion to change? Okay. Aversion to change, the house of flat, Calcarea carb. So anything that's familiar just sticks because I have adapted to this environment. That itself was a struggle for me. I don't want to go through that again. So these are the core themes of Calcarea. Now, because we are running short of time, I think that we should jump to a case example and do group themes. Individual remedies you can possibly read on your own because I think otherwise it'll be take too much time. Individual remedies we can discuss later on. So let me give you one case example of Calcarea. All right. So this is a case of an 18-year-old girl. This is a slightly older case from our homeopathic hospital. Patient resides in Dallas, America. She visits India because she's on vacation and her grandparents live here. She comes to our hospital OPD with eruptions since 12 years. Now the eruptions appear as hyperpigmented patches. The ODP is it started on her face, lower limbs, back of her ears and neck. She presents with severe itching, worse night, worse bathing, worse consuming sugar, any weather change, especially humid weather, which as Bombayites we know is the worst, perspiration, especially in the folds of skin, and draft of air. Sorry. Occasionally, it is accompanied by oozing of blood and a serous discharge. It starts in the folds of her skin and then spreads all over. History of applying hydrocortisone ointment on multiple occasions over these years because that's what provides relief. Associated complaint, reflux of food and water since 8 years, lot of water brash, eructation, so much so that they did a gastroscopy which showed chronic inflammation. Family history, atopy is strong, asthma, skin disease, family history of cancer. Patient as a person, craving for sweets, fruit and salty, thermally chilly. She has some food allergies, which came up on an allergy test, but she doesn't report any reaction even after consuming any of these. Sleep position, abdomen or sides, and history of talking during the sleep is what her mother says. Gynec history is all right. Mental characteristics, I'll just relay the important ones. The first thing she says about herself is, I'm very intolerant to injustice. I don't like whatever is happening in the world. Now, this is a case of 2019. So I'm not very sure what she was talking about, but this is the first thing she says about herself. Mother says that she's very sympathetic. She's very concerned about the poor. She likes to donate and help in whatever way she can. She says, I get confused while making decisions. Now she's studying at a college in America, which is away from her home. But she says, I'm very nervous and I always doubt my capability when making a decision. Okay? These are the patient's words. Don't think that I've put materia medica here. There is an instance where she got emotional. They moved from India to the US, which was about 8 to 10 years before she saw us, before she's met us. So at that time, she said, leaving my friends was very hard for me. She uses the word depression, but I would not really say it's clinically diagnosed. She says it's more of kind of a homesickness or missing the friends as a young girl. Even now, she says, I'm attached to them. And when I miss them, I get teary eyed. Why is that? Because I don't make new friends easily. So that was tough for her to leave. We have taken want of security. That's our interpretation of what she says. Because her mother also says that whenever she gets breaks, even if it's a long weekend, she comes home from college and she likes to be home. She likes to be in her comfort zone. This is what the mother says. And mother says, like most parents say, that she procrastinates. She will do her assignments and her academics at the last minute. Lot of anxiety about the future. Understandable. You're in college, you don't know what you're doing next. All right. So diagnosis, atopic dermatitis. We have taken the consent of the patient to show you. Those of you who are good with your skin diagnosis, you know that this is the chronic stage of atopic dermatitis. This is the third stage. You can read about the diagnostic criteria. You can see the skin changes. All right. So case analysis, young girl, atopy, history of suppression, strong symptoms at level of mind, generals and particulars. So kind of a mixed bag to decide your susceptibility and posology, right? Okay, now how do we come to synthetic prescription? Core theme, wants security, wants a familiar environment, goes home every time there's a break from college, misses her original home, those friends, confusion of own capability, self-doubt, element of laziness. So pointing towards Calcarea. On the other side, one thinking of Calcarea Carb, even though she's chilly, very sympathetic, focus on friends. She did not say, I miss my family, I miss my grandparents. So we chose a remedy called Calcarea Phos based on these traits. I'll just share a quick follow-up. First prescription, Jan 2020, Calcarea Phos 30, twice a day. We asked the mother to give in dilution. Reason being, in skin cases, I just prefer to give repetition and therefore dilution works better. Some of you will say, why 30, even though she's a young girl, even though we have characteristics. So two things I'll say. One is when I want to give repeatedly and there are structural changes, I prefer to start with a low potency. Second, what I have learned from my mentor, who is Dr. Farooq Master, is that if your remedy is right, it does match the susceptibility even when you start with a lower strength. So you can scale up. If you start with 30, it gives you the potential to possibly scale up. So these are the reasons. Petroleum was given as an SOS because folds of skin, because of weather change, if needed. But to be honest, it didn't do much in the case. We get a follow-up in 2 weeks because that's what I told the mom. Even though you've taken medicine for 3 months, give us feedback in 2 weeks because you're going back peak winter. Let us see how the dryness of skin progresses. Mother says she's much better, but itching continues. So CT all, we don't hear back from the patient for months on end. She follows up in August saying skin is totally healed, but stomach issues are a concern for me. It's just regurgitation. It's not acidic, but there is regurgitation. And this is important. No medicine since March. So they follow our advice, Jan, Feb, March, stop. Then I say, why don't you start Calcarea first just once a day instead of twice a day and let me know how the stomach is and the skin dryness. This one spot which she says behind the knee. So we do that. Mother says she's much better. You can see the back of the knee. You can see the elbow. She's quite comfortable. All right. Moving to magnesium group. Do we have time to quickly summarize or should we stop, Dr. Mansi and others who are here? Should I stop time-wise or should we quickly summarize both the groups? Can someone let me know? Continue. All right. Okay. I know it's your clinic time, so I'm going to be super quick. Magnesium, I spoke in my introduction about deficient nutrition and nourishment. Now, when you talk about pediatrics, those of you who are doing MD in pediatrics or who have a pediatric practice, we always talk about nature and nurture. These are the two most important words when talking about child development. So nurturing, which a parent or a caregiver is supposed to do, is deficient in magnesium. Therefore, they feel unloved and forsaken. Deficient nutrition at the physical level leads to malabsorption. Now, those of you who have Alan's keynotes handy or who know offhand, I'll be even happier. Tell me the stool of mag carb. And anybody can describe for me the meaning of this word repression. See, I've used the word repression, not suppression. So I want two answers from you. Tell me, anybody would like to attempt? If you see mag carb stool, you will see that it directly represents what you've studied in medicine under steatorrhea, fat malabsorption. So deficient nutrition, the child is not able to absorb. Mag mure is sheep dung stools. Mag carb is not sheep dung stools. Please check. Muriaticums have sheep dung stools. So mag carb directly given for clinically can be correlated with malabsorption, especially steatorrhea, which is fat malabsorption. Okay. Yes, as doctors, yeah, very good. Scum on a frog pond, so floating fecal matter, which means the fat is not being digested. Great. As Dr. Sadia says, repression is where the mind is not aware about it. So, what does that mean? Again, go back to Dr. Kent's example of an orphan. Repression means that I don't even know about something. So, how can I want it? How can I ask for it? I'll give you an example. Let's say that someone belongs to a family where finances have been tough. It is a home where money is a challenge, where people are very practical. They only focusing on work and tasks and things have to be done. They don't believe in celebrating birthdays or doing anything very elaborate. So this child grows up and doesn't know what that means. When this child grows up and starts attending school and gets invited for birthday parties, they see that at their friend's birthday, the parents make such a big deal about it. There is a big cake, there is a party, there's a celebration. So what happens in this case where the child they've attended someone else's birthday party? Let's say child one and child two. So child one never had a big deal about their birthday, no fuss, not used to, elaborate gifts, just small family celebration, one pastry comes, happy birthday, that's it. Child two used to a big deal on their birthday, multiple gifts, elaborate parties. But then COVID hits. In COVID, the child two's father loses his job, finances become tight. That year, they can't celebrate the birthday. Child two throws a fit because they are used to their birthday being a big deal. Then they said, no, but I want this for my birthday. I want a cycle. I want something. And the parents say, look, this year we can't afford it. We'll do it again. Next year we'll get you something. Don't worry. They explain to the child. So what happens? The child has a desire, but the child has to suppress that desire. In the first case, whether it's COVID, whether it's anything else, child one doesn't even know, so they don't have that expectation. So it is a feeling that is repressed. Okay, this is a slight difference between suppression and repression. And this repression in magnesium comes from having the feeling of being forsaken at a very young age. Constitution, by and large, very flabby, very puffy. Their skin appears oily. They are prone to slow healing. Premature looking, loose skin, laxity is seen in magnesium group. The crux of magnesium group is this repression leads to a lot of psychosomatic complaints. So magnesium group is actually a very good remedy for psychosomatic complaints, which we are seeing more of nowadays. So what happens here, because they have not received that care and love? Now contrast this to Calcarea, what I spoke to you 5 minutes ago. They are not aware that that is available. So they tend to become self-sufficient and self-reliant because they don't have that expectation. They don't know that this is an option, this is available. So they say, I have to do everything by myself, and that's how they learn to navigate through life. This feeling of being neglected and forsaken comes in an early age where children are dependent on parents for everything, whether identity, whether finance, whether food, whether house, everything. All right. Mind forsaken, feeling of not being beloved by parents, wife, or friends. Right? Can you see Mag Carb? You also see Calcarea here. This is a smaller rubric. If you see the broad rubric, just if you see forsaken feeling, you will see that there is Baryta also, carb as well as sulf. You will see Calcarea, carb as well as sulf again. And you will see your remedies from magnesium. Now here you can see magnesium being the most prominent. Mag carb, mag mule, magnesium metallicum, mag sulf, and limestone, which I've already told you is Calcarea. Because of this, because they feel that they are not getting the love or they're not getting the care, they, if they get it in even a small amount or wherever there is an element or a hint that they may get some affection, they want to keep that environment very peaceful. So they become very passive. You will see that magnesium people, they don't even like violent programs. They don't like violent games also as children. They will not like to play if someone is playing mock fighting, or, if you, I don't know if many of you are familiar with wrestling, WWE. Many boys growing up used to play that. But magnesium are some of the theme is of pacifism. However, if you refer to Whitmont and Whittle-Cass's book, they say that occasionally you will find magnesiums at the other end of the spectrum. So Whitmont says magnesium may well be called the most violent, ill-tempered, and erratic remedy, but also fearful and depressed. So this polarity is seen, but more magnesiums you will find in the passive category. Why is that? Because there is a fear of loss. They feel that if I disturb the harmony, then I will lose that relationship. Shorten says mag carb and mag mure are the most important remedies for children of quarreling or divorced parents. Now, let me draw your attention to a very important difference. Mag carb, there is a symptom, dreams of being lost in his own house, and mag mure has dreams of being lost in a forest. Now, about 15 minutes ago, I made a statement saying we may feel most comfortable in our homes, in our houses. So what does that tell you about mag carb? That tells you, that mag carb, even though they are there in their own house, they feel that they are homeless. That is the degree of being forsaken, which one sees in mag carb. Okay, so mag mure, what do you mean by forest? Here it represents that mag mule can find or make a home outside. So what does that mean? If my home environment is not conducive, maybe I find that love and affection in a hostel with my dorm friends. Maybe I find that in the future with a partner. But in mag carb, the issue is so deep rooted that they feel lost despite being in their own house. Magnesium group, marked sensitivity to pain. You all know mag carb is given for wisdom tooth pain, also a lot of neuralgias. In fact, if you read Materia Medica, it says what China is to loss of vital fluid, mag is for nerves. So mag phos, everybody knows, dysmenorrhea, colicky pains, various examples. All right. In magnesium, I will skip the case because then I think we are overshooting our time, right? What is the time? Yeah, it's almost 6:30. So we'll skip the case. We'll talk about Baryta. Yeah. In Baryta group, as I've said in the past, it's a stronger version of Calcarea. In Calcarea, they are unsure what people think of them, but in Baryta, they are convinced that I am worthless. I think there's a rubric also, delusion worthless. You can just check. All Baraitas are dwarfish, both mentally as well as physically, retarded growth at both levels, marked aggravation from cold. You know this. Baraita carb prone to tonsillitis, enlarged adenoids at any cold exposure. This is very important. Why do I say it's one step stronger than Calcarea? Because they are sure that they will be ridiculed. Okay, they are very sure that they will be mocked. So delusion, she is being watched. Can you see Baraita carb, Calcarea carb, both are there? Delusion being mocked, Baraita carb, Baraita mule, Baraita phos, Baraita sulf. Okay, so this is very strong. Calcarea, sensitive to opinion, wants appreciation. Calcarea sulf laments when not appreciated. Baraita, sure that they are laughing at. Shy and hiding, we've already spoken about this. They feel very small, incapable. Now, don't say they feel small because they are children and because we are dealing with pediatrics. You know what this means. I've already explained it. Okay, this feeling of smallness is also correlated to delayed development, and that's the case I'm going to talk about. That's why I was just rushing a little bit with the group indications. Okay, this is a very interesting case. Just spare 5 minutes because I would like for you to understand this case from a pediatric point of view and homeopathy. So this is a case of a young boy. He was brought to me when he was a year and 10 months. He's still under treatment. You'll know why. Chief complaint, developmental delay, both cognitive, motor, fine motor. No speech developed yet, no bowel control, which is fine at that age. Hearing is okay, they've tested that, and he can follow simple commands. Communication, walking, all delayed. This is the part of pediatrics that I want you to understand, and I want you to know how much in detail you're required to take birth history for such cases. Prenatal, primary infertility. Initially, parents have tried IUI, IVF, it failed. 12 years after getting married, there was a spontaneous and natural conception, which is this child. He was 1 week premature. There was respiratory distress, and I think the NST was not good, so they did an LSCS. Despite being just 1 week premature, he went into respiratory distress syndrome with pulmonary hypertension, so he was in the NICU. He also had neonatal jaundice, and he also had his first convulsion at birth. Now, those of you who have studied obstetrics, if you've finished your third year exams, you know when we teach you convulsions in a newborn, we always say that the causes of convulsions can be as simple as hypoglycemia to more conditions such as hypoxia, hypoxic encephalopathy. So that's what this child has. Sorry, this I've already covered. Associated complaint, he's prone to febrile convulsions. He's already had 2 such episodes of febrile convulsions. And given the birth history, he's on an anticonvulsant called Frisium every day, half tablet. Hypoglycemic convulsion at birth, that's what I've told you. Important generals, perspiration scalp, thermally hot, sleep position sides, thirstless, and craving for fruit. Observations of the parents, he is affectionate on one side, but when he's angry or when he's frustrated that he can't do something, he becomes aggressive. He bites himself and others, thumb sucking. Mother says his memory is good, he understands, but he cannot execute. Loves going out of the house, loves the bike rides that his father takes him on, and is prone to temper tantrums with breath holding spells. Mother's history during pregnancy, lot of conflict between the parents. She was not a happy pregnancy, even though they really wanted a child and had finally conceived. A lot of suppressed anger in the mother. Okay, so now in this case, I'll tell you, I first gave Calcarea Phos, tuberculinum 200 intermittent doses and Calcarea Phos 30 every day. He did improve, but it was very slow, and some parameters such as bowel bladder training, cognitive were not increasing at the rate I wanted. So I did a case review. I'll show you my analysis, and I came to Baraita carb. So what are the features of Baryta that I took? Dwarfish, arrested growth, obviously. Hiding self. Now, this was important. Why did I choose this? Because whatever the parents would tell me, and they would show me videos of proof that, he's progressed, he's doing this in the house. Whenever he would come to my clinic for a follow-up, he would literally try to go behind the chair that his mother sat on, head down, no eye contact, very shy, very bashful. So that I took as characteristic, and that's what made me switch from Calcarea to Baryta, to be very honest. Comfortable in his home and bike ride with the father. They had started a school and an occupational therapy, but he would not leave his mother's side. Sorry, this wants to work in family business is wrong. Please ignore that. Growth restricted and thumb sucking. So these were the features which I chose. So renewed prescription, Baryta carb 30 thrice a day. He starts improving at a much rapid pace. Now, I didn't take that consent to show you the videos, but now he is bowel trained, he is bladder trained. I'll show you the subsequent follow-ups. Bruxism, that is teeth grinding, has stopped. He is reciting a full poem. He is eating by himself. He now walks, he greets me. So there's a lot of progress. It's an old follow-up. The latest is April 2025, where, see, he's still shy. Speech is better, walking a lot better. Bruxism has come back. Now he loves school and he started trying to teach other kids. So that is what we're able to achieve with our medicine. Goes to the toilet now, even for passing stool. Leg strength, mother says he still falls, but he's able to walk very comfortably. He falls if he tries to walk fast. Drooling only when unwell, and she says craving for orange. So, what I want to tell you is that sometimes, like many of you may have thought, Calcarea Baryta can be confusing. It's these finer differences that we have to work on. I have switched from Calcarea Phos here to Baryta Carb, and I can see the rapid pace of improvement. So why did I use Cifalinum? I used Cifalinum because initially I was using tuberculinum again because of the developmental delay, but analyzing the mother's history also with this difficulty of conception, considering the pathology, I thought that the miasm was leaning towards Cifalinum. So I started giving it weekly, but then I stopped. It was just given for a few weeks. So that was the thought process. All right, so I think we should summarize and quick take-home message from my side that please remember that individual remedy study is very important. You can't just do group analysis and have all your prescriptions. This is just an easier way or a way of concising the vast materia medica. And with that, I just summarize by saying thank you. Sorry, we rushed and we couldn't do individual remedies because, homeopathy is just too vast for me to summarize in 1 hour. And I've overshot my time. If you have any questions, you can let me know now. You can reach out to me or via Dr. Mansi and the platform. Do you have any questions? We may not be able to share the recording because there are patients' pictures. So we will edit that and send it because consent is a very important, concern. You can email me or you can, if you want to ask me any questions, Kanika Sabharwal at gmail.com. You can always reach out to me. Any doubts, any teaching, anything that you want me to kind of touch upon again, do let me know. No, Dr. Zoya, you cannot get a PDF in the group of the PPT because there are patients' details. But if you've missed any part, you can definitely ask us and I can share it again. Dr. Mansi, you can just type my email address to them. On the chat box, I can just give it to you, to everyone, and then you can just reach out to me. I'm always happy to help. And
We have
being a
tuition.
teacher, I enjoy clinical discussions at any point of time. If you have any questions about what we have discussed, do let me know. It's clinic time, so people have to get back to practice. I have some of Instagram, that's also fine. You can see it on the
Ma'am, we have some questions from the chat box. Like Dr. Nikita is asking, which book is best for studying periodic table? Okay, thank you so much everyone for staying with us in this webinar. And we will have the question answers discussed in the comment box of YouTube channel on which we will upload this session. Thank you so much everybody.
Thank you, everyone. Have a good evening. Thanks, Dr. Mansi.